Hello everyone. So today we'll be learning a topic which is platelets. So first we'll start with how the platelets are formed, followed by its morphology and the conditions where platelets are increased and decreased. So coming to the introduction, so what is the normal platelet count? So this reference is from Dacey and Lewis, which is a book of practical hematology, 12th edition. So here we can see that the normal count of platelets in adults ranges from 1,50,000 to 4,50,000 platelets per microliter. And so what are platelets and how they are formed? So they are small anucleate. So that is one thing that we have to remember. They are anucleate fragments from the cytoplasm of a megakaryocyte. So a megakaryocyte is a precursor of a platelet, and the cytoplasm fragments of these are what platelets are made of. So what is their function? So as we all know, the function is support in hemostasis by forming a hemostatic plug. So we will not go directly deep into that function of platelets, because here we'll focus more on the morphology and how to identify platelets and the conditions where it increases and decreases. So this is a peripheral smear, and I just put this image so that you can identify how platelets look like under the microscope. So as you can see here, I'll just mark all the other cells also. So if you can see this cell, all these cells in the background, they are RBCs. And how do I know that they are RBCs? They are anucleate, and as we all know, they have a biconcave shape. So we can't see a biconcave shape here, but we can see there is a central pallor and everything. So that is why all of these are RBCs. Coming to the next cell that we can see are these. So what are these? All of these are WBCs, also known as leukocytes. So how do I know that they are leukocytes? They are the only nucleate forms that you usually see from the three lineage of subcells that we see in peripheral smear, and as we can see, all of these are neutrophils. Coming to the last cell and the cell of our interest, which are these small tiny fragments, pink fragments that you see here, all of these are platelets. So this is how a normal platelet smear looks like. So I'll just erase it so you can just see how it looks. So this is a normal platelet count. So by this smear I can know that this is a normal platelet smear. Going to the more deeper into the topic. So what is the size of platelets? It ranges from 1.5 to 3.5 micrometer in diameter. So now let's talk a bit about the ultrastructure of platelets. So they have actually a lipid bilayer, and they have no nucleus, as we have discussed it again and again. So beneath the outer membrane, we see there are microtubules. So what do these microtubules do? They maintain the shape, and during aggregation they depolymerize. So, and what is the main component of these microtubules? It is said, and I'm quoting from Dacey here, that it is actin, but it also has myosin and calmodulin. Other structures are also present. Coming to the central cytoplasm, the central cytoplasm contains three types of granules. The first one is dense granules, which is delta, followed by alpha granules and lysosomal granules. So we'll just learn few components of these granules. I think this is an important topic here, and I've just taken the important substances from each of these granules. So coming to the dense granules, what do they have? They secrete ATP, ADP, serotonin, catecholamines, and GTP, GDP. So you can remember ATP, ADP together and GTP, GDP together, followed by serotonin and catecholamines. So that completes your dense granules का secretions, followed by alpha. So alpha में क्या होता है? You'll have platelet factor 4, von Willebrand factor, fibrinogen, fibrinonectin, and factor 5. So everything which starts with F, you can put it here. That is platelet factor 4, factor 5, von Willebrand factor, fibrinogen, and fibrinonectin. So that finishes your alpha, and then we have lysosomal vesicles. So anything, one clue that I'll give it here, that anything with sedases or ACEs comes here, which is galactosidases, fucosidases, hexosaminosidase, glucuronidase, and cathepsin. So that completes your lysosomal vesicles. So just remember this table. This is again from Dacey. So coming to the conditions where platelets are increased and decreased. So since I've already shown you how a normal peripheral smear with an adequate platelet counts looks like, what do you think you see here? Can you find those A nucleate fragments that we had seen here? Yes, you can actually. There is one here, and probably this one. Other than that, I cannot see anything else. But what else can I see here? I can see all the other components, I think. So this is RBCs. As I've told, all of these, everything that you see in the background are RBCs. And here, this is a polychromatophil. So that I'll explain in some other class about polychromatophils and all the other RBC morphology in the following slides. And what is this? This is actually a lymphocyte. We didn't see a lymphocyte in the previous slide, so here you see a lymphocyte which comes again in the WBC, but we can only see 3 platelets in the entire smear. And what is this condition? A condition where platelets are decreased. So this condition is known as thrombocytopenia. So as we had already told, the normal count is 1.5 to 4.5 lakhs. So anything below 1.5 lakhs comes under thrombocytopenia. So this is a thrombocytopenia of a peripheral smear. And coming to the causes of thrombocytopenia, so it can be a spurious cause or it can be a true cause. So first we'll see what is a spurious cause. So when there is a blood clot, all of these platelets go and trap there. So when the counter is not able to count them as platelets, and that is when it shows a thrombocytopenia and followed by platelet clumping. So sometimes because of the anticoagulation is not properly working in the tube, when your vial is old, it causes platelet clumps and we might not get an accurate platelet count. So what do we do when we have a spurious thrombocytopenia? It's always ideal to go back to the peripheral smear. So peripheral smear is the holy grail to confirm anything which shows a spurious thrombocytopenia count. Now coming to the true thrombocytopenia. So it's always better to remember thrombocytopenia causes under 3 headings. The first one is decreased platelet survival. So something is killing the platelets. Next one is decrease in production, and the other one is sequestration. So in decreased platelet survival, I would like you to remember autoantibodies, so immunogenic destruction, which is usually seen in immune thrombocytopenia. So anything with immune thrombocytopenic purpura, chronic and acute, SLE and DIC, everything comes under decreased platelet survival. So that is our first point. Second one is anything which decreased production of platelets. So it can be HIV or any anti-cancer drugs or drugs like thiazide, diuretics, aplastic anemia, bone marrow replacement, leukemia, MDS, all of these come under decreased platelet survival followed by sequestration, which is usually seen in hypersplenism. So these are all the causes of thrombocytopenia. Now coming to thrombocytosis. So this is what I saw in my slide yesterday, and this is why I selected this topic, because this is one of the most interesting and nice findings that I like to see in the slides, because this is not that much harmful to the patient. It's usually because of the anticoagulation problem, but it is nice to see all these platelets clumped together, and you can put a note that because of to get an accurate platelet count, kindly send the sample in a citrated vial. So that is the comment that we usually give while reporting a smear like this. So yeah, what is this? So since I've told you, let's go in the same order. First, I'll try to so this is the low power. In previously, I was always showing you the high power. So again, let's go to normal. So you can see all of these, whatever is here in the background is RBCs. Yes. What is this cell? This is a neutrophil. This is a lymphocyte. And again, lympho, probably something in the neutrophil, precursor or neutrophil. And what everything else that you see are all platelets. So this is all the platelets that are clumped together. And here also, this is the same high power view of the slide. All of this platelets, and these are few large forms of the platelets. But everything else is platelets. So this condition where you see platelets more than 5 lakhs is usually known as thrombocytosis. So What are the causes of thrombocytosis? Again, it can be divided into primary thrombocytosis and secondary thrombocytosis. Usually, we see secondary thrombocytosis in clinical practice in the labs while you're screening your slides, and these are usually reactive. Why? They react to some surgery that patient has undergone to, something like an infection, inflammation, blood loss, or malignancy. But in primary, there is one condition which comes under essential thrombocythemia, and that is where we see thrombocytosis. So just to revise the slides again, let's go back to the normal. So this is how a peripheral smear normally with an adequate platelet count looks like. And this is how a thrombocytopenia peripheral smear looks like. Hardly any platelets to see in the slide. And this is how thrombocytosis looks like. I hope you understood this concept. Thank you.